Houston Methodist is the first center in Texas to incorporate intestinal ultrasound in practice. And since then, it's really been a mission of mine to train providers in learning intestinal ultrasound. So intestinal ultrasound is essentially a way of assessing disease activity. So this is simply an abdominal ultrasound where we're using a traditional ultrasound machine with abdominal probes where we are able to scan the abdomen. We're specifically looking at the intestines, both the small intestine and the large intestine. We can check for strictures or scarring of the tissues with long-term damage. We can look for other complications such as fistulas or even abscesses. We can assess if there's mesenteric fat. So different parameters that we can assess on the intestinal ultrasound to guide us. It is a point-of-care tool where you can utilize intestinal ultrasound in a standard clinic visit. So a patient comes in, you can scan them and find out disease activity immediately after or during your scan. I'm able to scan their abdomen and find out if there's bowel wall thickening. I can find out immediately if there's inflammation or not, and actually show them on the screen if there's active disease, and they know right then and there if there's inflammation, and I'm able to provide them changes to their therapy right at that clinic visit. I don't have to wait for them to wake up fully or get biopsy results back. I'm able to change care immediately within that visit. So it's really revolutionized how I manage my IBD patients. When I first learned about intestinal ultrasound and going through the IBUS curriculum, which is the International Bowel Ultrasound Group, there was no one in the United States certified in intestinal ultrasound. So I had to go internationally to learn this. We came back, started implementing in the United States, and afterwards when we explained and started advocating to all of our other colleagues, it seems that every other IBD specialist in the United States wanted to learn this new tool. Since then, we've started training many other gastroenterologists in the US. Module 1 for IBUS training involves a 3-day intensive course that involves lectures by international faculty on intestinal ultrasounds, the basics to more details of what to look for, to how to implement this into practice, along with multiple hands-on sessions with patient volunteers, normal volunteers, so the attendees can actually not only listen to lectures, but get hands-on early assessment on what to look for in intestinal ultrasound.
It's a great honor for Dr. Abraham as well as Houston Methodist to be able to host the IBUS Module 1. This is actually a relatively new modality that's coming to the United States. It is quite popular in Europe, but we haven't adapted it as much here in the United States. So having our institution be one of the first modules here helps us introduce a whole new generation of physicians to this modality.
So I hope to learn the basics of intestinal ultrasound, both the theoretical basis and some practical hands-on experience. And I have to say, Dr. Abraham is running an outstanding course. Everything is running beautifully, it is on time, and I'm gaining exactly the theoretical experience in intestinal ultrasound, coupled with a very basic understanding of the anatomy of intestinal ultrasound.
When they started here on the first day, they looked at the first ultrasound images and they had no clue what they were seeing. And now only 36 hours later, we just had our video case session. All of them in the group picked up the inflamed bowel. They picked up that the bowel was thickened. They picked up that there was mesenteric fat around. So I saw the excitement. So what we want to do with this workshop, we want to enable them to get started back at home. They are not professionals after those 2 days, but that they have an idea of what it looks like, what do I have to do with my machine, and that they are so excited that they say, I'm going to go the next step, the real intensive training.
In inflammatory bowel disease, we cannot always go by clinical symptoms because some patients may not have clinical symptoms but have active inflammation. Here, intestinal ultrasound can be quite useful because even though the patient did not complain about symptoms, and in a general clinic setting, we might let them go saying, oh, you're feeling fine. Okay, we won't change anything. However, if we can pick it up on intestinal ultrasound that their bowel wall is thickened, there is active inflammation, even before a patient presents with symptoms, we're able to treat their disease earlier before their quality of life suffers or their clinical symptoms actually manifest for our patients. The patient does not have to fast. The patient does not have to take any bowel prep. They don't need to have an IV placed. So really a general clinic visit, and in fact can overtake a simple abdominal exam. We're getting detailed information inside their abdomen of their bowel walls while getting a scan.
My journey with IBD started in 2012. I started having pretty significant abdominal pain, fatigue. I was in the midst of applying and interviewing for medical school when I was diagnosed with Crohn's disease. So I was diagnosed and was able, thankfully, to be treated aggressively pretty quickly and get my symptoms under control. I first heard about intestinal ultrasound probably about 2 years ago through Dr. Abraham. It was something that was offered in clinic. I had had a couple of colonoscopies for diagnosis and for monitoring. I had been asymptomatic, and so she took a look with the ultrasound. I'm in medicine, so it was cool to see and to hear about how she was using this in her practice. It was a very easy thing to do. There's actually days I forget that I have Crohn's because I really just get to live and take very little time at appointments otherwise. I've been able to finish medical school, residency, do a chief year, and start practicing medicine pretty seamlessly thanks to my treatments.
Intestinal ultrasound has helped me manage my IBD by allowing for me to have the procedure done immediately versus having to wait to schedule for an OR, for a colonoscopy, as well as you don't have to worry about being poked as much as you would when you have to go into a operating room for a colonoscopy. It's also just allowed for me to build a closer relationship with her where I'm able to see exactly what she's seeing immediately versus pictures that I would usually receive after my colonoscopy.
Since we came back and advocated the benefit of intestinal ultrasound in our IBD patient population, we've gotten significant interest across the U.S., especially amongst our IBD specialists, and we've started training a number of providers in this, both in the pediatric and the adult IBD centers. I find it a priority for me to teach and advocate regarding intestinal ultrasound here and across the world because it provides huge benefit for our patients to have a non-invasive, earlier way of managing their disease, and for providers to offer this to our patients within a clinic setting. When I was selected to host the Module 1 training for IBUS, I was of course ecstatic, but I also knew that it involved a lot of work. However, I think it was worth it because I was able to pass on what I want to do with my mission by training others and do it as part of our own institution and really represent Houston Methodist along the way.